Sandy Marsh has been nursing a knee injury for 8 months, suffering from a torn meniscus and Baker's cyst. Although the 66-year-old woman from Occoquan, Atlanta, says her condition is improving, recovery is a struggle without support from a family doctor. Alberta? Alta? Must be Alberta, right? Marsh has not had a primary healthcare provider since August, after her family physician left their local healthcare clinic to pursue a new career path. There are so many people and so few doctors. The number of physicians in Canada has been a problem for a long time. It's actually something we're doing better at. We're up to 247 per 100,000 as of 2022, up from 147 per 100,000 in 1978, but we're still lagging behind the OECD average. And a big part of this problem is that a lot of doctors choose to move down south to enjoy a higher standard of living and larger salary in the American healthcare market. She is one of a handful of seniors across the country who wrote to CTV News about their struggles with finding a family doctor. Particularly since the start of the COVID-19 pandemic, healthcare systems throughout the country have been facing staffing shortages caused by an exodus of nurses and other healthcare workers who left the profession. As a result, some Canadians are unable to secure a family doctor or book surgeries within a reasonable time frame, says Dr. Leslie Charles, a professor in the Department of Family Medicine at the University of Alberta. With the senior population expected to rise to new heights in the coming decades, experts are warning that Canada's healthcare system is not ready for an aging population and may leave seniors behind. Of course, it's a well-known fact that elderly people consume a ton of medical resources on a per capita basis because as you get older, your body starts to break down. You need more medical attention. So this is going to be a big problem for our healthcare system if the costs start skyrocketing, especially as the population gets older, more people retire, and that's going to mean less tax revenue. New statistics from Environonics Analytics, a marketing and analytical services company owned by Bell Canada, show the country's senior population is projected to surpass 11 million by 2043. That seems like a lot since our population is only 40 million now, even accounting for some modest population growth. And keep in mind that Canadians are reproducing less than the replacement rate, although our population is growing because of immigration. Even if we make it to 45, maybe 50 million by then, still seems high. 20% of the population being elderly. The data, based on a special analysis for CTV News, paints the senior population as the fastest growing age group in the country. This increase in the number of Canadians aged 65 and older will have far-reaching implications, particularly on the country's healthcare sector, said Charles. Amid a shortage of healthcare workers, Charles said she expects to see more seniors struggling to obtain a family doctor and access related services. Without seeing an increase in physicians, you have to imagine that with an increased number of seniors needing all different kinds of consults for different services, there are going to be longer wait times, she said. And this is one of the many problems with socialized medicine, is that you do have finite resources. And so they've got to be triaged in what doctors or bureaucrats think is the most efficacious manner. And that can have very serious consequences. The estimates of the number of Canadians who die every year waiting for surgeries, waiting to see specialists, is in the thousands to low teens, tens of thousands, like 10,000. And this is One area where having a market in healthcare, maybe a side by side market where we've got socialized medicine for the people who need it, the people who want to use that system, and then a market healthcare for those who don't want to be stuck in the queue, who have the resources, they can pay extra, and they do want to skip the queue. I think that's actually a solid solution because then it would reduce costs for the government run system because the people who would normally be treated by it would be treated by the private sector. And also, you would have the tax revenue raised from this healthcare sector. I mean, already a lot of Canadians are choosing medical tourism. They're going overseas. They're going to Mexico, to Thailand, and they're paying to get faster access. A lot of them are going to the States as well. They don't want to wait a year to see a specialist. They might not have that much time. And the thing is, we are a wealthy and elderly nation. We're growing to be. So if an elderly person wants to spend their money, that they've saved throughout their lifetime, buying a few more years of life, that's not a bad thing. That's their choice, their decision, and and our economy should facilitate it. That's what they do in Switzerland. Switzerland is another very rich, very old country, and people spend a ton of money on healthcare, on staying alive in their last few years of life, and why not? I mean, I'd like to think when I'm that age, not that far away, actually, I'll cling on ferociously. I'll rage against the dying of the light. So, I mean, I hate to think of it this way, but our system of socialized medicine, at some point, it's going to triage these elderly people out and say, well, sorry, but we only have so many resources, and why save you when we can do something else? Uh, so I would like to see a market in healthcare alongside the public system, two-tiered system. Let people purchase private healthcare insurance and pay more for faster care. Why not? Why shouldn't somebody be able to spend their money on getting better health care? And then this might also incentivize some of those doctors who are uh, going to the States to stay here. There might be more opportunities for them here. Additionally, you've got problems with the public system where, because the government's paying for everything, you have to have this strict licensure in place. And this prevents a lot of foreign trained doctors. We got 20,000 doctors in Canada who can practice, that know how to practice medicine, but they just don't have the regulatory approval. So in a two-tiered system, that doesn't have to be a problem. If you have an unregulated healthcare market, free market in healthcare, then let whoever practice, and consumers can decide, as well as hospitals can evaluate the credentials of these individuals. Of course, a hospital wants to maintain a high reputation, so they don't want to hire a charlatan, and we might be able to skip this regulatory procedure and allow some of these people to practice, especially when it comes to just very basic cursory care, Um, Statistics on seniors with disabilities. More than 6 million Canadians had a disability, according to data from Statistics Canada's Canadian Survey on Disabilities, published in 2017. Of these 6 million, 38% were age 65 and older. Same report shows the most common types of disabilities were associated with pain, mobility, flexibility, hearing. Chronic conditions such as high blood pressure, high cholesterol, diabetes, and heart disease are more prevalent among senior men than women, according to Statistics Canada, Canadian Health Survey on Seniors from 2020. The same survey shows arthritis and osteoporosis are more common among women. It is also possible that without enough healthcare workers to meet demand, seniors may die more quickly than if they received the care they needed sooner, Charles said. She used the example of someone who has problems swallowing, but no symptoms that would signal something more serious. After months, that person might notice their condition has gotten worse and they are unable to drink or eat. After going for an endoscopy, they might discover they have esophageal cancer, which is common among seniors. The cancer may spread through their body and force them into palliative care. Seeing as immune systems weaken with age, seniors may be at higher risk of death if they are unable to access quickly the care they need, Charles said. By not being seen and not being assessed and managed and supported, progression will happen quicker, and there will be adverse effects from that, including, more likely, a quick death, she said. With nearby health clinics unable to accept new patients, Marsh will travel to a walk-in clinic in Calgary to renew her prescriptions and meet her other healthcare needs, she said. She's also doing yoga and visiting a chiropractor to care for her knee, while hoping it doesn't get worse. You might as well go to the moon. For Jill Beaulieu, her doctor in Sussex went on maternity leave. Since then, she's seen several doctors in a clinic. And she needs her prescriptions refilled. And then they have some statistics here about the Canadian healthcare system, which are just horrifying. In Winnipeg, emergency department wait times were as high as 11 hours. And there's lots of stories in the media about people that are just sitting there waiting for care and they drop dead in the hospital, in the emergency room, just waiting to see a physician. Meanwhile, hospitals in cities such as Toronto or Vancouver have a wait time of about 1 to 4 hours. And she says, to go to the ER for me, you might as well go to the moon. You're not going to get seen. Other Canadians have gone as far as leaving the country for a surgical procedure. This includes 72-year-old Keith Braun from Steinbach, Manitoba, who traveled to Puebla, Mexico for shoulder replacement surgery in mid-June. After initially damaging his shoulder in 2020, Braun completely tore his rotator cuff after slipping on ice in April 2023, he said. That made it more difficult for him to move his right arm and left him in constant pain. He was told he would have to wait 18 months. Can you imagine? 18 months in constant pain. There's nothing they can do. No wonder people are getting hooked on opioids. That's what they'd rather. They'd rather you just start taking some Percocet or some Oxycontin. No wonder there's so many junkies out there. 18 months for surgery. Our healthcare system is totally dysfunctional and does not work, he said. And then after contacting a medical tourism company specializing in helping travelers plan medical treatments abroad, he was in touch with the surgeon in Mexico and had the procedure done within 2 weeks. Paid $35,000. Well, better than waiting 2 years. And maybe he overpaid a bit with the medical tourism company. You could probably just fly down and talk to a hospital, talk to a doctor directly. Of course, he might be paying more for a top of the line surgeon. I mean, medical care is not somewhere that you want to cheap out on at the same time if you have the money. Staffing shortages, and a lot of the doctors are retiring or getting ready to retire, which is going to make the situation worse. I mean, I don't see any way around it. Either a two-tiered system, or they're going to have to direct a ton more resources to the public healthcare system. I think relying on the market is the way to go. Maybe not entirely. Sure, you've got the indigent, you've got the working class. Maybe they can't necessarily afford massive hospital bills, but at least have an alternative for people that do want to go in the private system. For people that don't mind paying more to avoid the wait times. That's just going to make things easier on the public system. It's going to make it quicker for the people who are waiting, since that's one less surgery they have to wait for. It's going to reduce the total amount expended by the government, since the private sector will be doing some of the work. It just seems like a common sense reform to me. I mean, almost every country in the world, aside from England and Cuba, North Korea, has a private sector in healthcare. Germany and France, these are not countries that we think of with an inadequate welfare state. France has government spending more than half of GDP. I mean, these people, they are committed to social safety nets, but at the same time, they've got a market in healthcare for the people who want it. Like, why can you spend your money on a big truck or a vacation to the Caribbean, but not healthcare, not something that's so vital to your longevity, to your very existence? It's insane. We gotta get the two-tiered system, open up the private option, and make some serious reforms to our healthcare system to allow people to have a better quality of life without these absurd wait times, without these shortages, without ration care. We need to make some changes.